We can't hear you.
And I think I got to most folks, but not everybody. So know that we have a lot of planned activities and breaks throughout the day. So if we haven't gotten to take a look at each of you, I know that is our aim. And please don't hesitate to reach out to us. So welcome. We'll get started with that. I'll pass it over to our COC chair, Karen Roper, who will be honest. Thank you.
Hey, everybody. Welcome. I'm like so excited to see all of you in person. And I know we have this huge county, 7,303 square miles. Is that right? And I know for some of you, how many of you came clear on from the opposite side, like the desert region? Oh my gosh, welcome. Okay, and how many of you came kind of like from the middle section or southwest region of the county? Okay, and how about the western side? Well, we have these continuum of care meetings, and a lot of times we just see each other on the screen, right? And it's nice to be able to, as your chair, this like fills my heart with joy. That's why I always, as your chair, have requested that we do this once a year. And you know, our city, the city of Corona, is very happy to host and sponsor the meal for you and the facilities, because our city feels that it's important for all of us to work together to build collaboration and to work together for all the people that we serve. I also wanted to, I think we have, Tanya, let me know if I missed any other dignitaries, but I believe we have Sunday from Supervisor Washington's office. Sunday, you want to say hello to everybody? If you have anybody else from any elected official offices, let me know. But Sunday, can I say that you're also a proud resident of what city? Corona. And one of the things when Sunday and I were talking that made me so happy, she was reflecting, I hope you don't care that I'm doing this. She was reflecting on the meeting that we had last year. How many of you were with us last year when we came together? She said, wow, look at how many more people are here than even they were last year. And if we think about the size of the continuum of care, gosh, from when we started a couple years ago, Greg, remember when you were the chair and I was the vice chair? What was our big goal? Yeah, we wanted to make like just triple the size of the continuum of care to make it the most inclusive consortium that we could be proud of, not just countywide, statewide, but nationwide. And you know, we hear a lot of updates from our amazing county staff. Where's Miss Heidi? Where is she? Our leader of Housing and Workforce Solutions, and all of her staff, like Greg and Tanya and the rest, that give us these updates about how Riverside County is just rocking it. And then, of course, our behavioral health staff, where are they? They're like such big partners with us. Raise your hands if you're with behavioral health. I know we have some, because I know Heather is speaking with us today. There, okay. So we hear these things compared to other counties across the state and even the nation. We're rocking it, and that's because of what you all do. And I'm just so proud of you. I just love you guys so much and appreciate everything that you do to serve the community. So with that, we hopefully you got a complete packet of everything when you came in, and we're going to do some fun things, including playing games, which I'm going to have Miss Emma come up and explain the games so that she can remind me as the chair when I need to stop and pause so we can play the games. Do you guys have the someone find who games? Does everybody have that? And the bingo game. So Miss Emma, come up and explain what we're going to do, when we're going to do it, and then you're going to like grab me and tell me when I need to stop for that.
Good afternoon, everyone. Continuum Care Division. So,
For the online people.
Oh, okay, sorry about that. So on your agenda, there is a section there on number 5 and number 9 that correspond with these little sheets of paper that everyone received. And so our first activity 1 is going to be the bingo. As we are having our meeting, so you'll be listening out for the words that are on the bingo card. And if you hear them, make a note of them. And then the person who gets bingo first, are we going for a blackout or what? What are the bingo game rules? Blackout? Okay, so we're going for blackout here.
Ready. He's
Yeah.
like ready.
So we're going for blackout. So the first person that goes for blackout might get a prize. They'll get kudos, you'll get bragging rights. Do we have prizes? Tanya, do we have prizes? Oh, okay, yeah, so we have prizes, people. So that ups the ante, so make sure you're paying attention for those terms. And then activity 2 is going to be this find someone who. So there are descriptions on there, and this is more of an opportunity to network. So please get up, go to another table, don't cheat, don't take the easy route and just ask the person next to you. Start at your table, but please venture out. This is an opportunity to get to know others and just a fun activity for us to do together. If you have any questions, Gershom over there in the green can provide some additional clarification.
So let me ask our HWS staff, do we have people joining us remotely? Okay, everybody, you see the screens all around you? Give them a big hello to all of the people that are online. We just want to welcome you. You are a part of this, and we're glad that you could be here remotely. And there's some people in the room who said that they'll grab 2 lunches for you. Since you're not here, they'll have one plus the other. Is that right, you guys? Okay. So let me see here. First, we are going to, is the roll call. Guys, how are we going to do this today? Because normally people go online and we have all the people present. How are we handling roll call today? Okay, so everybody, so can you let me know when we reach quorum so we can take action? We have a quorum. Yes. We have a quorum. All right. So let's go ahead. That was agenda item 1. So with the quorum, we're going to go ahead and move to agenda item 2. This is kind of hard to coordinate 2 different mics. You guys, if I forget the other mic, will you remind me? Because we have to have the mic for the people online. Okay, so agenda item 2 is the consent items. And we are going to be reviewing to approve the October 23rd meeting minutes. And also, I'd like to take it in one slate if we can, the 2025 Continuum of Care calendar. So with that, do I have a motion to approve the consent items? I'll make a motion. So Michelle Davis, our vice chair, made a motion. Who made the second? Sonia. Hey, thank you. Do I have any abstentions or objections? Hearing none, the item passes. I kind of like this standing up. Okay, at this time, we're going to move to agenda item 3, which is public comments. Anybody can address the continuum of care for items that are not on the agenda. Zuli, did we receive any written public comments? No, we did not. Do we have any folks that would like to make a public comment? Okay. Go ahead and state your name and the organization that you're with, and welcome.
Hi, my name is Savannah Brown, and I am with the Youth Action Board. So I just wanted to talk about how, first of all, how proud I am to see the growth within the YAB over the past year. And thanks to the service providers within our county who work effortlessly to provide these services and to ensure that we have access to all resources. However, there is still a need with more extensive services to ensure that youth are being connected efficiently and effectively. Riverside County is rich in resources, but making these connections between the youth and the resources is what we need to strengthen. I'm excited to see what's in store to strengthen these connections, and I'm excited to be here and network with all of you. So thank you for your time.
Good job. Hey, let's hear it for youth advocacy. I'm curious, that was a beautiful piece of public input. Did you want to submit it for the record so that the staff have it? I don't know, Zuli, if you want to ask her if she wants to submit that written for the record because it was beautiful. Yeah. Okay. All right. Let's go ahead and any other public comments? Yes, please. We have a microphone for. We have another public comment. State your name, the organization you're from.
Thank you. Dr. Adrian Lamar Snyder from now NORA, formerly the Riverside Area Rape Crisis Center. So we are excited that we spent about a year in strategic planning, our rebrand of the agency. So more than 50 years, we've been the Riverside Area Rape Crisis Center. And we are now, as of November 1st, NORA, which means Nurture, Outreach, Resilience, and Advocacy. We support victims and survivors of domestic violence, sexual assault, and child abuse. I'm happy to report our new name.
Thank you. Beautiful. Any other members of the public would like to comment? We were recognizing representatives from elected officials. I think we have another one. Daryl, want to get up and say hello? I know you're a part of our Board of Governors. Tell everybody who you're representing, what elected official office.
Hi, representing, good afternoon. Yeah, I can speak a little lower. Daryl Fry, representing the office of Assemblymember Dr. Corey Jackson. Super excited to represent, and also super excited to be elected to the Board of Governors. So thank you so much
Yes.
for trusting in me. I will give you proud of my words, okay? Yeah, thank you so much, Karen.
You're welcome. Anybody else want to make a comment? Okay. You guys hear me say this, I probably sound like a broken record, but one of my favorite things is the leadership spotlight. That is something that's been near and dear to my heart as the chair, to be able to spotlight the amazing talent that is investing time in the people that are in crisis. And I am super excited to have somebody that I work with on a regular basis from behavioral health. She's just an amazing person. She's actually oversees the mobile crisis management teams that are with behavioral health. And we have a team that is outstationed in Corona City Hall. And so because of that, I get to work with Heather a lot, but this is a model that's a region-wide model. I want to tell you a little bit about her from her bio. Heather is a licensed clinical social worker who's been in the behavioral health field for 25 years. She has worked for RUHS Behavioral Health for the past 23 years. I'm gonna make this bigger, there we go. Much of that time providing services to individuals who are homeless and experiencing severe and persistent behavioral health challenges. For the past 2 years, she has been the supervisor of the mobile crisis system of care, helping to build new programs and develop partnerships with the community while bringing her experience working with consumers who have multiple needs to staff development. And I have to tell you, she has a lot of patience with me. I have lived experience. I think I've shared with you guys, I had a father who was seriously mentally ill, in and out of homelessness, and he committed suicide. And so to me, the work that behavioral health does is just so deep in my soul. And so Heather, I just think the world of you. I love you. Please come up and tell everybody about the amazing work that you do. Give her a big round of applause.
Okay. All right. Managing my, okay. Thank you. Oh, I've got my cheering section up here. Hi, I'm Heather Sylvester, and I am very excited to be here today. And, oh, is there a clicker, or do I just say next? Oh, love it. Love it. Okay. So I'm going to talk a little bit about mobile crisis and mostly the parts that will pertain to all of you. We've had mobile crisis teams in Riverside County for several years. And I know we've talked in the system of care about mobile crisis, but the main things, I only have 10 minutes, so I'm going to go really quickly here. We have a lot of different types of teams. Our job in mobile crisis is really designed to help people, help keep people at the lowest level of care possible. Oh, yes. Oh. I can't wander. Okay, no wandering. Okay. All right. Ooh, lots of demands. Mics and no wandering. Okay. All right. I can do it. I have a Coke Zero. I can make it work. All right. All right. So, we have multiple, the goal of the program is really, we are a diversion program trying to serve people who are experiencing a behavioral health crisis in the lowest level of care possible. And when we say behavioral health crisis, we don't determine what a behavioral health crisis is. The person in crisis does. I'm used to working with the people who are, that you all are used to working with. So the people, this is gonna, maybe not the most recovery friendly language, but the people who are talking to their shopping carts, those are my people. So when I came to crisis, I was like, okay, these are my people. And then I go and we go to the schools and kids are freaking out because their parents took away their cell phone. I'm like, oh, this is a crisis? What? You have, this is not a crisis, but that is a crisis in crisis. So it is not my definition of a crisis. It is whatever the person before us is a crisis, because to that kid, that cell phone is their connection to everyone and everything. So we really serve, we don't define what a crisis is. You can call us because you have someone showing up to your cooling center who is under the influence. Or maybe they're having their first set of symptoms and they don't know how to cope with those symptoms, right? So for some of us, we've been maybe working in this field for a long time, and so we're used to the more severe end of the spectrum, and our definition of crisis is that. For some of us, it is whatever cannot be put off till tomorrow, or can, we really want to get out in front of it because we want to get people the care that they need at the lowest level of care. Our goal is not to put people in the hospital unless there is no other alternative. And to that end, we have a multiple variety of teams. So we have our community behavioral assessment teams, which are our co-responder teams. We often hear them as CBAT, and those are our therapists who ride along with law enforcement. There are 17 teams currently, although I think we have some 17 locations. Some locations have more than one team. And so you can see that they are all throughout the county. We have them all the way from Thermal to Corona, Cathedral City. And the goal, again, is law enforcement provides the safety while the therapist is able to provide the behavioral health services. And so this has been a really effective model in engaging people and providing the support, as well as supporting law enforcement in doing
the tasks and services that they're not necessarily trained to do. So it's been a really effective model. Another co-responder model that we have piloted is our CAP team. And this is a team that is currently located in Hemet, and it is a partnership with a substance use counselor along with an EMT, and they are responding in that area. And so they can provide medical kind of assessment, and especially for that area where there is not a lot of emergency behavioral health care, they can divert people instead of sitting in an emergency room. They can get them to alternate locations like a mental health urgent care and to actual places of treatment, do behavioral health screenings, get them substance abuse screenings so that they can get the appropriate level of care. So our benchmark service is our mobile crisis team. And so these are these are teams of two, usually a therapist, a substance use counselor, or a substance use counselor and a peer support specialist, someone who has their own lived experience. They go out into the field. Again, we go anywhere that is safe for our teams to go and someone is willing to let us in the door, we're going to show up. We're available 24/7, 365. And we go out into the field to assess the individual, to talk to the family, to provide resources and support, and to try and come up with a safety plan by providing as many supports and resources as possible. So if we can give them resources, we often do family therapy on site, because a lot of times it's the family needs help communicating through issues. Maybe they don't know about the services that you all offer. So we're pulling from what you all have provided in the community, helping them apply for Medi-Cal, CalFresh, those types of things so that they have some hope for tomorrow. We then provide a safety plan. We follow up to make sure that those resources and support work. And often we're able to divert and keep them safe in their home or in the community. If we're not able to do that, we then try to do a voluntary placement somewhere. So maybe it is at a mental health urgent care or a sobering center, or a voluntary admission to a psychiatric hospital. Again, voice and choice. We're trying to give people the options that work best for them. We only do a 5150 as a last resort when it's really about, there are no other options and that person is putting themselves or someone else in immediate danger. And so our crisis teams operate all throughout the county. We even have teams in Blythe. We're very excited about that. And 24/7, including weekends and holidays. So we have a public facing number, and I left flyers up there. There's public facing and a provider number. So all of you are providers. You can access the provider number and be able to call us and reach our dispatch number. I think one of the teams that I'm very excited about, and Karen mentioned it, is our management team. We have, for those that are maybe not in an immediate crisis, but for those of you maybe that are working with someone who is, say, homeless, and you notice that there's a behavioral health need. There's substance abuse, there's mental health issues, and you know that they need connection to services. That takes engagement. It takes time. Your focus may be on the housing. That's where some of our management teams can really come in. I have teams that go to Path of Life 2-3 times a week, and they're in the shelters. We're at the Corona shelter. We go and we support the residents there, helping them build those relationships and destigmatize mental health and behavioral health services. I have my own diagnosis. Being able, most of my staff have either their own diagnosis or have a loved one who has their own diagnosis. We share our stories. We talk about that. We talk about services. And by being that bridge, we also can walk alongside people and help them get access to care by taking a little bit of a slower pace versus just the crisis. So we have a team of 4, a therapist, a substance use counselor, a peer support, and a case manager. And those teams are available to provide 30, 60, 90 days of bridge services to really bridge the gap between crisis and getting someone connected. Because a lot of the people that we all serve are not going to be someone that you can hand an appointment card to and they're going to show up at a clinic. It's never going to happen. So my team is going to be able to drive them to that appointment, pick them up and be like, hey, we'll sit in with you during that appointment. This is what they mean when they're asking you those questions. My team, if you're trying to hook up with county services, my team can come and do those assessments where they're located so that instead of then having to show up at Tuesday at 2 for a therapy assessment, it's already done so that they can just go and see the doctor right away, right? Like those types of things that get in the way of them getting services, we try and minimize all those barriers. We're not magic. I mean, I think we kind of are, but we're not fully magic, but we do our best to reduce some of those barriers so that people have a better chance of getting really that follow through with services. And again, we have those management teams all the way from Corona all the way to Blythe. So on the flyer, I have listed to reach the management teams. There are supervisors like me all throughout the county. Myself and Tiffany Bulware are the western area. Joelle Galindo is the southwest, like Paris to Menifee area. And then we have Michael LaJudice is Palm Springs, Banning, Beaumont. And Maria Martinez is Indio de Blythe. So all of their, like our contact information is on the sheet. You can reach out to us as supervisors if you're interested in the management team. All the information's on the flyer and I'm here if you have any questions. Okay. All right. Appreciate it. Thank you.
Okay, see if I get my microphone situated here. Okay, I think it's time for activity 1. Are you facilitating us, Emma?
People have been playing.
Okay, well, come on up and you can you can facilitate it from here.
Does anyone have blackout yet? No. Okay, yeah, so for the bingo, we're just gonna keep going through and as folks are chatting. Maybe.
Pardon me?
Maybe you can work in some of these words, so.
Oh. Okay, so if you hit bingo, make sure you let us know. I wanted to also, I didn't get a chance, you know, there was a lot of work that went into getting all of the food, all of the logistics and everything set up. And I want to introduce you to a new member of my team who was really instrumental in helping us get everything together. Jennifer, do you want to stand up so we can embarrass you? So that's Jennifer Munoz. And just so you know, she came from CityNet. She crossed the other side to the government side. So anyways, we're super excited to have her as part of our team. Also, I wanted to acknowledge, I believe we have the chair of our Board of Governance here, Leticia. Did you want to stand up, Leticia? I know you're a part of the Board of Governance. I am. Anybody else that's part of our Board of Governance that could be acknowledged here? Greg is. This is the body. How many of you all know what the Board of Governance is? You know, the Board of Governance is the body of the continuum of care that approves the policies and the funding. That's kind of important, right? So, and you all have the opportunity to be a part of that and watch online. But remember that all of the feedback and developing the continuum of care, the policies start here, right? And then we feed it up so that when funding policies are presented to the Board of Governance, they don't forget what the continuum of care said. Is that right, Leticia? Yes. So anyways, thank you so much. I know you came a long ways. Yes, yes. Thank you guys so much. Okay, so let's see. Now the next agenda item is 6.1, our point in time count, and I think we have both Tanya and Emma. Is that right? So I hope you guys are all ready. The count is coming. Are you ready? Okay. Miss Emma and Tanya, are you ready?
Good afternoon again, Emma Pressing with the COC. We are excited to announce, I think for now, the third or fourth time that the point in time is coming. We are scheduled to have the count on January 22nd in the early hours of the morning. We have our next community planning meeting, which is scheduled for December 4th at 3 p.m. We also wanted to share that we have brought on a consultant to help support point in time efforts. So if you see an email with applied survey research included in there, that's the reason why. So they're going to be helping us with coordinating meetings and putting trainings together. Our plan is to open up registration after our December 4th meeting. So be looking out for additional information on that. If you have questions, concerns, considerations that you would like to bring forward, that December meeting will be an opportunity for you to provide feedback. We will be sharing our survey tool, which our committee has come together to review to make sure that the new HUD data standards are included within that tool. We do have some sort of legacy questions that we've agreed as a community to include that are still included in that survey tool. So we'll be sharing all of that information during that time. We've also began to reach out to the cities and schedule individual meetings with each city to talk about the pit in their jurisdiction. So please just be looking out for those appointments and plan to attend.
I'll add two more things in that we are really hoping. Microphone. Oh, we have to use both. Okay. Now I understand. All right. So what I was going to add to that is we are hoping to get the help of every single COC member. Our hope is that we can spread you out across all 28 cities and unincorporated areas of the county so that on every county team, we have subject matter experts, advocates, allies who can be there to support community volunteers who may be doing this for the first time. And city teams, county teams who, again, may be in public service, but this isn't their, day to day as it is with you. So we hope that you will remain flexible as our chair, Karen Roper, has always taught us to help us with that so we can reach as many people as possible. And then in case I missed it, Emma might have already highlighted that as we've done every year, we want to stay true to our tradition of this being more than a count. And we are going to be working closely with our veteran partners, VA Loma Linda, the Housing Authority, US Vets, White House Social Services, anyone and everyone. If there's an organization that I did not name that is in the room and serves veterans and would like to be part of an effort so that any veteran who is identified on the day of the count can be fast-tracked to housing and services. Connect with us. We'd love to include you in one of 3 access sites that are going to be coordinated across our entire county to facilitate that linkage. In the same vein, we are looking to do a similar effort for our youth point-in-time count, recognizing we have a lot of youth providers in the room, but certainly more coming on board through our youth homelessness demonstration program, or what you guys have all come to know. You know, we love our acronyms as YHCP. And so those providers will also be helping us spread across the different deployment sites, so that if there is a young adult who is identified, we can do the same. We can make sure that we ask them the question, do you want housing? Do you want to go into housing today? If the answer is yes, then we want to coordinate transportation and other wraparound care to wrap around them that same morning. So this is really gonna take a village. It's gonna take everybody in the room and more. So as Emma said, keep an eye out for the registration that will be coming out in the next couple of weeks. And to our city partners who are in the room, we owe you, because we know that this takes a lot of coordination, it takes a lot of resources. And so we very, very much appreciate being able to host this with you in your regions. So I think that's it for us. And with that, I'll hand it back to our chair. Thank you.
So before we go to the next agenda item, one thing I always say this, and I want to remind all of you, another one of my favorite things to do as the chair of the Continuum of Care, and Michelle, our vice chair, is we love to sign letters of support. And so if you're working on a grant and you want, if really it helps for you to move the needle and be competitive, because a lot of federal and state funding agencies require collaboration with the Continuum of Care. Many of you have done that, but please, we love to do it. It's super easy. We can get you fast turnaround. So letters of support, don't forget that, okay? So Emma, did you want to talk about the activity?
Yes. So we're gonna do a blitz round. So I'm gonna call out some words, and the first person who gets blackout, you just yell out. And my Vanna White here, I'll date myself. I don't know if everybody gets that context, but my Vanna White over here has some gift cards. And so the first 2 people that get blackout will have what is it, Starbucks gift card? $10 Starbucks gift card. All right, word number 1, we're gonna go fast, okay? Motion. Word number 2, dedication. Word number 3, capacity. Word number 4, APR. Word number 5, calendar. Word number 6, community. Word number 7, award. Word number 8, RFP. Word number 9, YHCP. You gotta yell, Elena, or it doesn't count. Word number 9, YHCP. Word number 10, amazing. Word number 11, 2024. Word number 12, HUD. Anybody else? Word number 13, room and board. Hold on. Who got, oh, somebody got it. Okay, they got it. She didn't get it? Okay. Shelter. Unsheltered. Prevent and end homelessness. Okay, Tanya, we got a winner. Yay. Okay, so you guys need to connect with me, right? Yeah. For the next one,
How fun. Okay, are you guys ready? There's also wanted to acknowledge another person in the room who, if you may not know about what they do, but they're an amazing partner. We work with them in the city of Corona, but they're available regionally, and it's called Just Serve. And so Donette is here and it's part of LDS. And Donette, can you stand up real quick and just say what come on up here. Just come up here real quick, because you can get a lot of volunteers. You guys can get a lot of volunteers and support from Just Serve. So she didn't know I was going to embarrass her, but it's an amazing opportunity with the community. Go ahead, Donette.
Okay, so I am an administrator for the website of justserve.org for Riverside County. So every one of the cities has specialists that are trained. I get the blessing of training them to come out to the organizations and teach you how to post up your activities, needs, donation drives, whatever service opportunity you have, and the site matches volunteers with your service opportunities. So when they were talking about the count just now, I'm like, oh, we got to put that up on Just Serve. Let's go. Because each one of you needs to register on the website. That's where you start. JustServe.org. Get yourself registered and just peruse. You can put in your city and you'll see a plethora of opportunities for service. There's also a remote part of the website for those that are not able to get out. Okay, during COVID, we learned, oh my gosh, there's a lot we can do from our living rooms, right? From our bedrooms. So I invite you all to get registered. I'll be posting up the count as soon as I get the information on and connecting all of us together through service one to another. So my name's Donette Wheat. I'll just give you my email. It's wheatdonette@gmail.com. So it's Wheat.
Yeah, they'll send it out.
You can send that out. My cell phone number is mine, 951-264-0563. Shoot me a text. That's the best way. I have a million emails, right? So that's the best way to reach me. I'm a speech pathologist by profession. I work in the school district, so I do have it full time, and then this is my other day. So it's a blessing to be here. I'm honored to meet you. This day is amazing, and God bless you. Thank you so much.
So the reason why I did this is we always, at the last minute, need volunteers, and that's just what they do. They get the community together to get volunteers. And I know you all are so busy, so please feel free to take advantage of it. Okay, we do have another announcement, something that is like really super important time of the year for us to participate in and be a part of. And so I hope that you guys will sign up and let's see, who's going to tell us about it? Is it Gershom? Gersham's going to tell us about the longest night. Come on up, Gershom. Would you like this microphone?
Oh, yes, please. Thank you. All right. Hello, everyone. How's everyone doing today? My name is Gershom Hiron, and I am the homeless youth coordinator for the Riverside County Continuum Care. And so it is an honor and a pleasure to be here before you guys to announce our upcoming longest night of the year event, which is scheduled to take place on Thursday, December 19th at 5 p.m. And it will take place over at Fairmount Park in Riverside. And so on behalf of the Continuum Care, we would like for you to join us on this night to commemorate the lives of those who were lost while experiencing homelessness out on the streets of our communities. And I would just like to emphasize that this event, it serves as a reminder of the importance of compassion, connection, and the shared responsibility that we have to support our vulnerable neighbors. And therefore, I encourage you guys to bring your friends, your families, and your loved ones, as this event is open to the community. And together we will have the opportunity to light a candle in remembrance and renew our commitment to creating a future where no life is lost to homelessness. Additionally, I would also like to extend a call to all of our partnered agencies. If you have had any clients who sadly passed away this year and wish to honor their memory, we invite you to submit their information to our email at toc@rifco.org. And if possible, we also encourage you to share a photo to help us personalize this tribute, as our team is planning on respectfully, framing these photos and creating a memorial display to celebrate their lives. And so if you have any questions or just require any additional information about this event, feel free to inquire at coc@rivco.org, and one of our teammates will be more than happy to help you. So thank you. That's my time.
Amazing leader that I look up to, that I've learned so much from, that is often behind, put her staff at the forefront. But because of her leadership, so much happens across this region to develop affordable housing, shelter, HMIS, coordinated, everything that we do. Heidi, can you please come up and say hello to everybody? You're such an amazing leader. And I just would, didn't know I was going to do it, but she's just so remarkable. And Heidi, I just thought maybe you want to say hello to everybody, and I could tell everybody how much we love you. Let's give her a big hand. She's amazing. Oh.
Thank you, Karen. Hi, everybody. She really didn't tell me she was going to do this, but it's always a pleasure. And she is right. I do like and prefer to be behind the scenes. I'm often asked what drives the work that we do at Housing and Workforce Solutions. And the thousands of transformations of individuals who come through every single one of you guys' doors, and through the help of this community that we have managed to build, we get to see the after. And that, I think, is something that I know I consider it a blessing. And as I always have these conversations with each of you around this room, that you share in that sentiment with me as well. And we get paid to do this work. That's just amazing to me. So for that, I am grateful. And I'm also grateful in this season, as I take a look at all of your faces around this room. I mean, Leticia, you and I have worked together for 24 years. And I also consider that a blessing. The relationships that we have built, the new ones that I'm hoping to build, and to continue to have this opportunity to build up and be the bridge and continue to work with one another to make these stories and turn them into from struggle to thriving. That is what I hope to continue to do as part of the work that we're doing at Housing and Workforce Solutions, one life at a time. And I'm so grateful for all of you around this room who get to do that within this community of the County of Riverside. So thank you, Karen. You have been a blessing to our team. And I know every one of our team members expresses that, because I tell you, talk about behind the scenes and in front of the scenes. This lady is a hurricane, and a good hurricane, a hurricane that shakes things up, but leaves them in a better place. So thank you for all the miracles you make happen, and for the opportunity you have given me to build this relationship with you and the entire continuum of care community. Thank you for the opportunity.
Okay, we promised that we were going to reserve a big part of the agenda to be together and break bread together and get to know each other and, just share. I hope you guys will, as we have time for dinner, that you will network, and that, while you're enjoying eating and talking to one another, that if you haven't met other people face to face, that you will take the time to do that. Now's your opportunity. Networking changes the world. And relationships, you think about the work that we do, what is it? Like 98.9% of the work that we do is relationships. Do you agree? It's about, right? It's about relationships. And so we need each other. So I hope you guys will take the time to do that and enjoy the food. There's box lunches back there. Jennifer, the cookies and the fruit and all of there's mac and cheese. There's all kinds of stuff back there, right? Help yourselves. The boxes are labeled. You can kind of grab whatever flavor that you want. And then, just enjoy this time. We're going to have, we're going to take time to have dinner, and then we will go ahead and let you know when we're going to do the Continuum of Care Awards, which is a really exciting time because you all got to decide who is being recognized. And that's really important. You guys have the benefit of telling us who should be recognized and who are the superstars in the Continuum of Care. So let's go ahead and break. You guys can just go ahead and, I don't know, Miss Emma, should we break by tables or do you just let everyone want to go up? You guys just want to go up? Yeah, just go ahead and grab. Go ahead, you guys, just go for it. Please, I hope you will grab food. If you had a lunch, go ahead. Remember, it's the holidays. It's the season to be chubby, right? Hi.
I did not play the game right. I did not deserve this card.
Oh, you didn't?
No, I only got one line. Everybody was like, speak it, but
How are you?
I'm good. How are you?
Good.
See you. So I have to give this back. I did not play the game right. I didn't know that.
Okay.
Zuli, you guys are still muted. Lawrence muted.
Now's the time for some important recognitions. And as I had mentioned to you, we sent out a survey to give you all the continuum of care for those that are here, for those that are online, and even those that aren't able to be here, the opportunity to recognize some amazing leaders across this region. And so we are going to be recognizing the 2024 Homeless Leader of the Year. Yeah. So the Homeless Leader of the Year is Devon Smith. You want to come up?
So here's a certificate presented to you from our COC chair and DOG chair.
Congratulations.
Thank you.
Congratulations.
Thank you very much.
And this is from Assemblymember Corey Jackson's office, here to also give you an award. And then we also have a certificate from Supervisor Washington's office. So congratulations.
Thank you. Thank you. You want me in?
Yeah.
Yes, please do.
You're so good. Yep.
Better.
All right, 1, 2, 3.
Thank you. Just want to add. I want to talk a little bit about the process. All of you remember that we sought nominations from our entire Continuum of Care membership body. So we're honored to recognize Devon, who not only was nominated initially, but received the most number of votes. So as I said earlier, and I want to make sure that our participants that are attending virtually can also hear from online, is that both our COC chair and BOG chair, Tafita Lara, who are here, are helping us recognize.
Zuli, I can't hear you.
You're muted again.
This is Carol. I can't hear anything that's going on there.
Yeah, I think Tanya turned off the mic.
Hmm. Is there any way I can get the picture back? Because I'm not seeing anything or hearing anything right now. And this is Carol from
Give me 1 second, Carol. I'm trying. I don't know how, because you are my main person up here, Carol.
all of you voted for was the homeless agency.
There we go.
The Year Award. And I know that Director, she virtually is now here today. They're also one of the years advocate for the Banning region. The agency has been recognized for really meeting individuals where they're at and serving everybody. It's really serving all populations and have been critical in that. So we wanted to recognize, actually, all of you wanted to recognize and make it happen as an agency of the year. They did a little taken of time each of the honor and recognize statement action for going above and beyond Riverside County. Your efforts have made a lasting impact on the community. We are proud to acknowledge the dedication of your team. And Carol is here virtually. Hopefully, she'll be able to share a few words. I know she wants to see, but Devon is here in person to accept the awards from, again, our COC, Assembly Member Corey Jackson's office, and the county boards. What we would like to just add that maybe smaller organizations that fight for you at the table, talking about ways that we can build capacity for organizations to continue caring. So let me, Carol, congratulations.
One, two, three. Beautiful, thank you.
For our team, I know Carol wanted to share the words. Are you able to unmute her?
Yes, Carol is on the Zoom, and I'm watching every minute of this and so proud of Devon and Faith in Action for these awards. Thank you so much. It is quite an honor. And you give us hope. So thank you for this amazing amazing award. Thank you. And I think Devon can probably say more about some of the work that we do if that's what you want to do.
Carol Melba is a fearless leader. She is, she's has inexhaustible energy. The reason that Faith Action is saying work that it does because of Carol Melba and great leadership. I also want to commend or mention our staff because we are just ordinary people that came together, but together we have some extraordinary things, and we're very pleased with this. Thank you.
Hey.
Thank you. Yeah, one more service award that each of you voted for, and this is for our Youth Homeless Leader of the Year award. And all of you are proud of it because 4 or 5 years prior to COVID, this particular year, each of you have been working aggressively to address youth homelessness. As a result of that, we were successful in being recognized by $7.4 million to that. And part of that initiative resulted in us being able to develop a planning body as our youth action board. We regularly, with many of you who are part of the Youth Advisory Council and mentors, be with them, to encourage them, and to ensure that they are aware of all the resources to be able to meet you where they're at and plug them into the care that they need. So it's really surprised that this year we wanted to do something special. That some adults say that people in this stage has no idea. So, you know, in recognizing I want to recognize Savannah Brown. Savannah is a whole beautiful woman dedicated her career to supporting young adults through affordable home systems that are regulated and operating state house. Here are a testament to the great work that that organization does. For many years, it was the only organization in Riverside County that served homeless youth. So Savannah, thank you for being fearless. I know that's a common word that we're using today, but it's because in order to do homeless advocacy, you have to be fearless. And Savannah represents just that internal honesty during public moments and how she talked about the work that she did with that organization. So congratulations, our teacher and I want to supervise and celebrate you. Thank you. Wow, I had no idea. No idea. Yeah, I love this word. It's very interesting to me. Like someone earlier said, it's here to do this, it's blessings. And I'm just glad to be able to do it and to be a leader in this work. And I love it. And I'm able to be here. It's never you and these people. Okay. Have you? Yeah, well, we're inspiring people, we think because tomorrow, but today. It's really exciting being a change agent. And, you know, I started being out when I was like 17 years old in this space. How many of you started when you were young? It seriously, and you know your harness with these things. So super excited. Come on up here. We have that today, right? Yeah. Okay. Sometimes we speak louder. Thank you for letting me do that. I have to make sure that everybody that is listening can listen to this far. So I talked a little bit earlier about our great appreciation for each of you and all of our leaders who held these meetings hold and break it out to have a discussion around a topic that, of course, centers around people, but also these tough conversations to have for many different reasons. And I see on the department, the county, all of you who wanting to recognize our CBC chairs who have been instrumental in facilitating these that I truly go above and beyond and speak with us probably on a daily basis. There's not a thing that you don't hear from your chairs, and they are always advocating for the cause, and also each of you, which is noted by how the agenda has changed over time and how events like this have been put together. So, we wanted to start off with Michelle Davis. Michelle has been doing this work for a long time, and just 2 days ago, facilitated a homeless forum with all cities across the region to highlight the incredible work that is being done and hopefully other cities to step up and do more. So Michelle, thank you for championing the right here. We are ready to pull this small, very small organizational appreciation. Thank you. The next thing that we want to recognize, is our wonderful, Karen Rover, who has. Karen is by far the best Karen, can imagine. She is really has made this lifestyle. And Karen, I can't think about, I completely admire you and long to one day be as brave as you are in this space. We all appreciate you, and I speak on behalf of our entire team who connects with you daily, probably multiple times a day to make things happen. And that's the thing. It takes fearless bold and having been to regularly our willing to push the needle to push things into action. So Karen, thank you. We love you. We're so excited. For the next decade. Because I feel this mind for fingers. And I think honestly, time was being gracious because I'm just, this is such an off. I mean, it's just can't stop thinking about how we can, create systemic change, change the world. That's because, so back to you. It's why different years since they're all of you guys, and I know Michelle feels the same way. So I'll try to find someone to give this to. I don't have to be done. We love you very much. Okay. Right. I love what you have to say.
One, two.
Okay, that's gonna lead us to the next step.
So I'm doing a time check, we only have about 6 minutes, so I'm gonna change it up. Well, how many people really want to do the second activity? It's gonna take a little bit of time. Okay, is everybody in favor of when I finish on time? Okay, so we have one prize, and I'm going to give that prize to the person whose birthday is the closest to today. So do we have a November birthday? November birthday. When's your birthday? The 10th. Amy? The 4th. Anyone after the 10th? No, mine was the 9th, so that I don't count. So you are. Because you see every time. I'm very.
Alexander, she oversees our Michigan housing where we have home furnishing and the management. We're really quite concerned about the place for her. She is a very amazing lady, and we are, if you want to, please grab it because our recent Dorado residents are excited about the fees and the lunch she's going to take does that. So they're excited. Lots of food, she's probably going to take it to them. So
Okay, let's see. We doing announcements now? Okay, I'm being a bad girl. Okay, let's see. Yeah. Okay, so this is I'm out of my element, aren't I? You guys like me better on camera. I'm not so wild and crazy, right? You'll have to forgive me. We're gonna take this time. This is your opportunity, especially here we are. What month is it? Oh my goodness, you guys, can you believe this year is almost over? So I want you to put on your strategic hat about how you want to change this county and come up with some cool agenda items. So this is a call for agenda items for the next Continuum of Care meeting. I won't walk around the table and put you on the spot and ask you for one, but I hope that you will. Does anybody have any requests for agenda items right now? Oh, our Madam Vice Chair, Michelle. Asset mapping, did you hear that? Okay, so Zulu, we getting that? Asset mapping, which is really cool. And I know we've started some of that already with our Continuum of Care, but I think if I understand the vision of our Vice Chair, and this is certainly my vision too for asset mapping, and we have more organizations and people that are not Continuum of Care funded. This is a big county with us, so we need to really do, you all are ambassadors to get out there to help us to do asset mapping so we can see and, bring all of the different resources together. Did I do it right for you? Okay, thank you. Who else has ideas for agenda items? Anybody? Come on, don't be shy. Okay. She's saying, Griselda, I love you. If you're online, my dear, I wish you were here so I could give you a hug. She said, come up here. It's about Prop 36 and how the sheriff and who is responding? Okay. Yes, well, probably all the law enforcement agencies. I think that would, be good. And I think, they're in the beginning stages of kind of getting their sea legs about that. But, Prop 36 was passed. What does that mean, in terms of how there will be a response? I can tell you, just so that you know, we've been advocating, us as the chair, the vice chair, and the HW staff talking to the different cities and law enforcement agencies. And it's exciting to hear. We're not hearing a lot of, we're just going to start arresting and jailing people and sweeping and all that. We want to keep doing what we know that works, which is very encouraging. But still, this is the beginning phases, right? So that's a great suggestion, Griselda. Anybody else? Okay. Then now is this time we have the opportunity for announcements. So we have a microphone we can pass around if people want to make announcements. Raise your hand. Come on, you guys. This is the holiday season. I am sure you have a lot of stuff going on that you might want to announce, or maybe you have a new program that you're launching that you'd like to partner with people. Oh, look it. It just so happens. Did you want to come up here? Okay. Come on up, ladies. Okay.
Hello, good evening. I am Trish and I'm with All Persons Housed. We do transitional housing in the San Jacinto Valley, and my name is Carol Givens. I am the owner and co-founder of Mrs. B's Table. We feed the homeless and help out low-income families in the Riverside County. And together we formed Shelter Pathways, which is another nonprofit that we combined our nonprofits together. And we are based out in the San Jacinto Valley. And basically we are a resource hub for other nonprofits and organizations. So we service the unhoused and the low income community. But this past Saturday, the reason why we're up here is because we launched the inclement weather center in the San Jacinto Valley. Actually, we are the only inclement weather in the Riverside County. And so far our stats, and it's overnight, should I say. So they check in at 4 p.m. and then they check out at 8 p.m. And when they check in, we do run stats with them, and we just don't take them in like we, find resources that they need, but in the morning, so that way when they leave, they're leaving with resources to help them get off the streets. So we do case management in that part. But just with the success that we've had with only being open for 3 days, we've already placed a veteran in permanent housing. My house is actually going to come and get him for my transitional housing. We've helped a single mom and 3 kids get placed in temporary housing through the Hemi Unified School District. And we've been able to take 25 individuals off the street at night, just from Saturday to today. And I'm pretty sure there's already a line right now waiting to get in. We've partnered with 2 of the hotels in Hemet and San Jacinto to be able to take these people in, and basically we gutted it out, pushed in cots, give them blankets, give them hot soup, water. And honestly, it's been going great. They literally come and eat their soup and go to sleep, surprisingly, right? They're not freezing outside, so they don't have to sleep with one eye open to watch their belongings. We do search them, make sure they don't have anything that they're not supposed to have. We have overnight staff there and security patrolling the parking lot as well. And it's been a great success, but we're doing this out of our own funds. We did a huge event in October, which was 1010 which was our Shelter Pathways Homeless Outreach Day. And we raised funds that day, and we're using those funds right now to operate the hotels that we have. So we're up here to ask for in-kind donations or anything that would help, basically, so that way we can move forward and continue to do this in December. Right now, next week we won't be open because the weather will be like 48 degrees. So we only open when it's 40 and below, or feels like 38. So that way they're not freezing out there on the streets. We do need more cots. We are waiting for our proposal to get accepted through the Salvation Army. We'll be able to use their building so that way we can take more people in. But in the meantime, we can't wait and sit around for people to, approve our proposals. We're going to just move forward and do something, that no one else is doing. And we were talking to the president, and she was just like, it just takes, someone to just, take the initiative and do it. And that's exactly what we're doing. So if you guys would like to or get any information about that, you can reach out to us. We'll be here lingering a little bit after, or you can take our phone number down, which is 951-590-1694, and you'll get my direct line, and I'll be able to send you out the link that we use that we take donations, or we can pick up cots or blankets if you have that.
And
Thank you.
Also, I would like to collect information from the nonprofits that are here today, because we are just doing, just taking them off the streets. We are providing case management, like she said. So when they leave in the morning, we want to be able to call someone, hey, this is such and such. I have this person here. Do you have room? Can you take them? Can you put them in your program? Are you able to do that? And it's been working great. The people that are receptive to it. Right before we came here, we just took a family of 6 off the streets. One of the mother has a 2-week-old, and they've been living in their car. So we were able to connect them with CityNet, and they were able to enroll them in their program. So we want to collaborate with you guys. We operate on nights and weekends, when I know some don't. So we're here to fill that gap. So use us, give us money, but also use us, to be able to, help each other out, because it's all a group effort. And the more we work together, the more we're able to prosper.
Thank you. Thank you.
Does anybody else have any announcements? Harmony? Gershon? You had something, Gershon?
If you have any more professional desire you wish to get them in pursuit, please get in contact with me. I'm using my work cell on there, as well as my email. So really, I'm going to be providing professional desire in all sizes of the world, male and female, to really support our youth experiencing some financial challenges to acquiring these sustainable items. So please just make sure you reach out to me. I'll be happy to coordinate either picking up you or we can figure it out to drop it off at my place residence. So please just give me a call or a text, voicemail, whatever the case may be, and I'll be happy to help. Thank you.
So before we adjourn, I just thank you so much. Before we adjourn, there's to see all the upcoming meetings, and then y'all approve the calendar for next year. And as I close this out, I thought maybe we could just remember this one thing. This work is not for sissies. And sometimes you may feel like it is just nothing but an uphill battle, and you face just insurmountable challenges. But don't you know that it's those insurmountable challenges that turn into the most amazing things that happen for the very people that you're serving. So if you run into a roadblock, whether it's funding or a partnership or lack of donations or employee turnover, it could be a multitude of things. Clients that you thought you got so far, 5 steps forward and then 20 steps up, whatever it is. Just remember that all the people that need our help are counting on you. And just remember, no difficult challenge goes wasted. And always around the corner is something amazing. And I say that to you. Gosh, I'm feeling a little emotional again. You'll have to excuse me. Because I just this week clocked 5 years with the city of Corona, but I worked 35 years with the county. So I've been in this space a long time. I know you think she's old, right? But it's because I have a passion, about people. And so I just want to encourage you guys, because I know sometimes we feel like, you feel like the little chicken whose feathers are just a tattered mess because it's so challenging. So just remember that as you're facing difficult challenge in the space, or if you're facing like successes, please share it and shout it on the mountaintops, because other people need to be encouraged and reminded about all the successes that we have. So we all, on behalf of the whole team that worked to put this in-person meeting together, we just want to say thank you. Happy Thanksgiving, Merry Christmas, Happy Holidays. And we look forward to our next meeting and for the exciting work that is ahead of us. Who wants to get to functional zero besides me? Come on. All right, everybody, the meeting is adjourned.
Bye. Thank you all for this meeting. Take care.
Yeah.